good luck getting my vote if that's the approach. None of that is in the bill. The IDD community, our seniors, children, single mothers, if you're able-bodied, you should be working.
We've got a couple clips to look at of Republican Mike Lawler on CNN having some disagreements, or claiming to, with MAGA and their Trump bill. So let's see what's being stated, how much of it is based in reality, and how much of it we can debunk. So first, if you can, leave a like on the video. It helps us out tremendously. We really appreciate it, and let's get right to it.
So with all due respect to my colleagues, the fact is we have a very tight margin, unlike in 2017 where they were able to disregard the views of members like me who voted no because of the cap on salt. They can't do that this time. What we have said from the very beginning is we are willing to negotiate in good faith, but it has to be in good faith and not trying to jam us with a number as they introduce the bill for markup. That just won't work. I won't tolerate it. And good luck getting my vote if that's the approach.
The salt deduction argument is weird because there is merit on both sides. Honestly, it's essentially a federal tax deduction from what you paid in state taxes. This can be for income or for property or both, right? Having the deduction both favors high tax states, which are predominantly Democrat, who subsidize the poorer Republican states, but it also benefits high income earners that obviously get larger tax breaks from having larger income or larger property values. I'm kind of agnostic on them. Again, there's merits to both sides. I think I would lean more towards probably no on property and yes with a cap on income, but I'd have to read a lot more into them to get like a fixed position on it. But I'm fine with the federal burden being larger than the state one in terms of taxation, but you also don't want like a middle-class New Yorker paying double taxes on his income than someone in Indiana making the same amounts, while a large portion of those taxes are also going to subsidize Indiana. Like there's a bit of equality, I guess economic equality that could be had there, but I'm not sure exactly how much salt taxes would even play into that.
Another thing on the table that's really led to a budget fight is Medicaid. That idea, as you know, making these changes to it, no matter how you frame it or package it, is extremely unpopular with voters. There was this recent poll showing 76% were opposed to slashing Medicaid funding. Does that worry you?
Look, I have been very clear that protecting benefits for eligible recipients is a top priority for me. It's why I fought back against changes to FMAP, why I fought back against changes to per capita caps or block grants or dish cuts. None of that is in the bill. The focus within the changes that have been presented are on eligibility verification, speeding that up from an annual basis to a semi-annual basis, citizenship verification, making sure that illegal immigrants are not taking benefits.
To be clear, illegal immigrants do not receive Medicaid federally. I wrote an entire article with the sources linked on this. It's the first link in my description, but it's, a total misnomer. They do utilize emergency services that account for less than 1% of Medicaid spending annually. So maybe that's what he means, but like, it's not like a sum of money worth mentioning or anything like that. I do want to stress, though, undocumented immigrants absolutely should receive Medicaid federally. It's kind of insane that they don't. The idea that, one, because you don't have documentation, you shouldn't be given care if you're like sick or dying and bleeding out is insane. Also, just like pragmatically, if there is a undocumented immigrant that needs healthcare, they have a disease that could be easily treated with that healthcare, why have them spread it rather than just cure it? I mean, it makes no logical sense any way you want to look at it.
Requirements for able-bodied adults without dependents. There is broad consensus both within the conference and frankly across the country that if you are able-bodied without dependents, you should be working to get a job or going to school or volunteering. You should not just be collecting benefits and not engaging in work or other activity. The bottom line is Medicaid is a program to help people in their time of need. And except for those that have long-term needs, like the IDD community, our seniors, children, single mothers, if you're able-bodied, you should be working.
Yeah, I don't know where he gets this from. On any poll you could look at, Gallup, Truth, I mean, anywhere you want to go, the Americans favor universal health care. They even favor it in a majority opinion when you ask if the government themselves should insure it. So like, no, people don't agree with you sycophants and your rich donors that are paying you to pretend that private health care is more efficient. when it's not, and it's not more popular either. And aside from the fact that most people on Medicaid already work, and attempts to do this on the state level saw no increases in employment, but it did see decreases in the insured rate, it also makes no logical sense to try. No one can logically explain to me why people should have to work to deserve the ability to afford life-saving healthcare. Please, I wish someone could make that make logical sense to me. Give me a logical explanation, especially Christians. I urge someone who claims to be pro-life, to explain to me how someone deserves to die if they can't pay out of pocket for healthcare solely because they don't have a job. Explain that, please.